one station of your PLAB 2 exam uh, that that if you are going to pass it, because I know that there are a lot of people here who are in the middle of their preparation. There are people who have an idea about their teaching stations. So my presentation would be about a general approach, that how should you what are the things that you have to keep in your mind while practicing these stations, and while how can you do well with your limited knowledge or limited practice even in the PLAB exam.
Excuse me, Dr. Saima, can you please speak a little louder? We can't hear you clearly.
Okay.
It's very muffled. Yeah.
Okay. Am I audible to you, to everyone right now?
Yes, now it's better.
Okay. Am I audible to everyone right now?
Yeah, it's much better now.
Okay. I will try my best to speak as loud as possible. Okay. So regarding teaching stations, there are, in total, there are 7 to 8 teaching stations. And in the PLAB 2 exam, either you have 2 combined stations or 1 combined station and 1 teaching station. Uh, Sometimes when you are about to start your preparation of PLAB 2 exam, you find history taking stations, ethics and counseling stations very difficult. And some people are, find it hard to understand how the PLAB 2 exam works, what is the, how to crack the PLAB 2 exam. So if you are finding any difficulty in the preparation, I think teaching stations, they will give you a kickstart also. So teaching stations, there are about 7 to 8 teaching stations that are quite common nowadays in PLAB 2 exam. And believe me, these are very easy to perform and very easy to practice. And if you know what you are going to teach, if you know what you are going to say, if you have a ECG teaching station or subcutaneous injection teaching station, so you should be very clear that what you are going to say. Uh, and regarding the history taking stations, the simulator will be the one who will give you clues, who will tell you that, okay, you have to, talk about this thing, or you have to make highlight this problem or this point. But in teaching stations, you are the one who control uh, how the station will be, and what sort of things um, the simulator will not give you any clue. He will just tell you at 6 minutes that what exactly he wants you to describe to him or her. Otherwise, you are the one who will decide that what you are going to talk about. So the first and most important thing, I think, not about the teaching stations, but about every station of PLAB 2 exam. Just keep it simple. Keep it as simple as possible. Don't complicate the things. Don't even try to teach difficult concepts, because in teaching stations, as it is mentioned outside the cubicle, that you are going to teach someone who is junior to you. You are an FY2 doctor, you are a very junior doctor, and still you are going to teach someone even junior than you. So your concepts, your teaching your teaching style should be very simple. You should teach simple things. You should give simple concepts. So don't go for anything that seems too difficult. For we all have worked in hospitals at some point, and we know the nursing staff around, they are more interested in clinical things, in simpler things. And the FY1 or the medical student, they are also interested in simple things and simple concepts. So keep that always in mind, and don't go for anything complicated, anything that can lead to some complicated conversation. uh, I think the first step of PLAB 2 exam preparation, and especially the teaching stations, is homework. And when I say that how to prepare, before looking for any study partner or committing with your study partner that, okay, now we are going to practice teaching stations, you have to do some homework. And regarding the homework, there are three important things that you have to do. And the first and most important thing is that watch Geeky Medics videos multiple times, because in nowadays in corona situation, you won't have enough time to practice at your academies. You won't have mannequins or models available to you. So it's a very I think Geeky Medics videos are really really good source. So watch them as many times as possible, because when what I used to do is, while I was preparing for PLAB exam, that whenever I got stressed or I got, I was sitting idle and I was in a place where I can't uh, study or I can't practice, just used to watch Kiki Medics videos. They are 2 to 3 minutes videos, and you can watch them at any place. So where we are watching and other videos on Facebook or Instagram, we can watch Kiki Medic videos. That is quite good. So whenever you will watch these videos, you will learn something new. So it doesn't matter that you have watched it one time, once or twice. I would recommend watch it as many times as possible till your exam day. And most of the teaching stations now, think, if you are going to teach someone, you are going to make, you are going to think that what I'm, for example, as I have to give this presentation, I prepared that presentation, I thought that what am I going to talk about. So this is how you are going to do these teaching stations in PLAB exam. So you should make a script of your own. Otherwise, if you are, or you should have some, you should annotate some points. You should write some points in your notebook, in your notes, whatever you like, that what am I exactly going to talk about. So you should be very clear long before entering the GMC building, that if I have an ECT teaching station in PLAB exam, what am I going to talk about. So that is really really important. And if, because if you go that, okay, I will teach about any of these things, then no, it won't help. You should be very clear, because the simulators and teaching stations, they don't either they listen to you, or they have an instruction that they will distract you, so that you try to convince him or her to listen to you. Okay, so but most of the time, if you are teaching them easy simple things and not difficult to comprehend, they are not going to bug you, they are not going to throw tantrums. So be very simple and make sure that you know what you are going to talk about in the exam. And the third most important thing is that most of the people, when I was practicing for my PLAB exam, I used to think that if nobody is there to practice with me, I can't practice well. No, that's not true. Even except especially in teaching stations, that's not true. You can practice the teaching stations uh, in front of the mirror also, but make sure that you should make your own script of 6 to 6.5 minutes. You should make a script that you are able to practice of talking about it. So just like a speech, your speech should be of 6 minutes or maximum 6.5 minutes. So the other 1, 2 or 1.5 minutes, that will be the time the simulator will take talking to you, questioning you, or giving you comments about what you have taught them. So step one, I would say that it is the most important step, because you will be very confident while practicing, while performing the station and the exam, if you have done enough homework about it. Am I audible to everyone?
Yes.
Okay. Okay. The next step is practice. Once you are done with your homework and you have practiced a few times in front of the mirror, you have a script of your own, that is your own, uh, um, uh, you have designed it for your own self. Now you are ready to practice it with someone, with your study partner. You are ready to practice it. It would be great if you have, you just do a commitment with your study partner that we are that practice do some stations, ECG teaching station, or some other important stations like subcutaneous station and abdominal examination teaching stations, and we will practice them. And you will be both of you will be able to teach each other and tell that while conversation what are your mistakes, because sometimes when we are practicing with ourselves, sometimes we are um, our, our tone is not that good, or we are very fast, or we are very slow, so the other person will give you your feedback. And once you are ready, uh, just take some mocks near your exam, or the exams, the academies are offering the exams, the mocks. So that would be a good idea to improve yourself. Well, talking about the common things regarding the approach of teaching stations is the first and most important thing I just mentioned before. I will say that again: keep it as simple as possible. Keep everything as simple as possible. The something that is understandable, that is not confusing, because you will be under great stress at the exam day. So make sure that you know what you are talking about. Regarding the approach, your data in there, as we know that in PLAB 2 exam we are marked in three different things: data gathering, IPS, and management. So in the teaching stations, when you will be standing outside the cubicle, you will know that who is the person sitting inside. Either she is a nurse, or F51 colleague, or a medical student. You will know his or her name. So in this station, you are not going to see a patient. You are going to see one of your colleagues. So you are going to introduce yourself, but you are not going to ask his name. You are going to confirm that name. Hello, my name is Saima, one of the junior doctors working here. You must be Anna, one of the nursing staff. Am I right? Or, hello, my name is Saima, I'm one of the junior doctors here. You must be David, one of the FY1. Am I right? So this is how you are going to start the station. It will save your time. It will make sure that you are confident. It will sound confident, and you will not fumble. So this is how you are going to start your station. And that is the way you are going to greet. Because if you will say, okay, my name is Saima, one of the junior doctors here, can I please confirm your name and age? Uh, well, myself, I would not say about anything that when I took the exam, she answered my questions, but she was not expecting that question. She was expecting that I will say that your name is Anna, and that the first learn about ECG, or you are here to learn about EpiPen. Am I right? Yes, doctor. So you can ask her about the reason of interest. So I have given us an example of the question: how can you ask about the reason of interest? So why do you want to learn about it? Or okay, so are you learning new things? So may I know, is there any particular reason you want to learn about EpiPen teaching? In the EpiPen teaching, this is the one station I'm referring it, that in which you have the mother. In even in that scenario, you will also say that you must be Anna, mother of David. Am I right? Yes. So can you please confirm a few information regarding your son so that we can talk about more? She will give you some information. But still, most of the teaching stations, in when you are talking to colleague or talking to your nursing staff, your approach should be informal. And regard the third point, like ask about anything particular you want to learn. This is something really, really important, because when you will ask him that, okay, I can see from my notes, or I that you want to learn about ECG, or you are here to learn about subcutaneous injection. Is there any particular thing you want to learn about, or is there anything in particular you want me to discuss with you today? This is the question, because similar these are ECG is a very vast topic. Uh, these if you are talking about subcutaneous injection, so it is there are a lot of things you can talk about. So there will be something really specific they will be interested. For example, in urine dipstick test teaching station, the person will be interested in either he or she will be interested in how to interpret that, or they will interested that I don't know how to perform this test. So you should keep that in your mind, that what exactly does the simulator pointing towards, uh, where what he or she is instructed to ask you about. This is really important. Regarding the interpersonal skills, your interpersonal skills start the moment you enter the room. Most of the time when you enter in corona times, you have to look towards the camera, and you have to say my name is this and my GMC number is this. Afterwards, you have to look towards the simulator, and you have to greet them with a smiling face. uh, yeah, some people may have that in mind that we are wearing a mask and they are wearing a mask too. So I think that wearing a mask for 1.5 year now, we know that we can judge a person, if who is wearing a mask talking to us, is he or she smiling or not. So that you should have a smiley face while talking to the simulator from the very, very start. And the in teaching stations, the most important, okay, okay, the most important thing regarding regarding these stations is that you have to appreciate that person, that he is here to learn something. And it's really, really important for you to appreciate that, because this is something that is you are expected to do. If you say that I'm here to learn about the ECG, and you say, okay, I will teach you ECG about ECG today. It's not easy to teach you all the concepts today, so we will arrange another meeting. So tell me, what do you know about the teaching? Your appreciation is missing. Now your IPS is down. Your IPS, you have failed to show your IPS skills at this point. The first 2 minutes are the most important uh, minutes of every station, no matter which station it is. Because in these 2 minutes, you are going to build a rapport, and are going to give an idea to the simulator, whether it is a telephonic consultation or face-to-face consultation, that either you are a confident person or not. So he or she is going to make up his or her mind about you, about your personality. So this is really, really important. And the next thing that is important is that you have to acknowledge their involvement. You have to acknowledge that they are answering your questions, they are answering your they are answering your questions, they are understanding it. So you have to ask them about it. Is that okay? Am I understandable to you? You can always stop me at any point if you think that I'm going too fast. These are the statements, these are the phrases that are going to show that you are a good doctor, you are a safe doctor, you are interested in teaching them about it. And the most important two most important things while working on your IPS is your tone and your speed of talking. Sometimes when you are too empathetic, your speed is too slow. And sometimes when you are sometimes when you speak too fast, your tone gets monotonous. So this is something that you have to practice on your own first, while doing homework. about the teaching stations, that you should not do monotonous. Your speed should be good while talking, because you have to explain the procedures in urine dipstick testing, in EpiPen station, in abdominal examination. You have to talk about a lot of things. It's not important to complete the station. I can understand that, but still you should, it shouldn't look like that you are just trying to taking the advantage of these 8 minutes, and you just talk about inspection, and in those 8 minutes, even in that case, you will be very slow, and the other person will not get a good impression until and unless you are giving a very good impression of giving a lot of information along with management. Otherwise you will be considered really really slow. So your speed should be very good while talking, not very fast, not very slow, and your tone should not be monotonous at all. And the most important and the easiest way of involving your simulator is asking him questions. Most of the time if you ask them questions, they say I don't know, or they give you an answer that is quite vague, because they want you to talk about it, or they give you the time to talk about it further. So but you have to ask the questions. It's really really important. You can score 12 out of 12 in teaching stations. It's not difficult at all. If you know what to talk about, you have a script in your mind of your own. And you have to practice with your study partner to improve your interpersonal skills. And that is the most important thing. Now the next thing is management. If you are keeping things simple from the very start, you are able to teach about simple things, and it's you are able to explain. So when you are thinking that I have to keep things simple, you will talk about common abnormalities. You will talk about common diseases that even if the simulator is not sitting in GMC building, he or she might know about those diseases. So and for example, you will talk about if you're talking about ECG, you will talk about that heart rate is normal with, if it is, this is the range of normal heart rate. If it is more than that, it is called increased heart rate or tachycardia. And do you know when do you have tachycardia? Well, whenever you are having pain, you can have tachycardia. If you are running fever, you can have tachycardia. So what if a patient in ER comes with chest pain and tachycardia? It's very important to inform your seniors. He might be having a heart attack. See, now you have talked about a very important concept. You have touched your management, and you have shown that you are a safe doctor by telling your nurse colleague or your junior colleague that you have to inform the seniors as soon as possible, because this is something that could lead to something life threatening. So see, you have to be very very confident. You have to be very well prepared that what you are going to talk about, and then you have to keep on telling him management and simple things about the topic, for example ECG or urine dipstick testing, so that it is understandable for them. And the next thing that I have mentioned about management is that whenever you are talking about, the most important thing, that you are a junior doctor, you are teaching a junior person. Most important thing, if you don't understand anything, inform seniors immediately, because that shows that you are a safe doctor. It will improve your IPS, it will improve your management marks, and because this is what they are looking for. At the level of FY2, you have to be a safe doctor. They Junior doctors in every healthcare system, they're not expected to perform major procedures or anything that is quite complicated. They're expected to inform their seniors about it as soon as possible, and they are expected to differentiate between a serious and non-serious situation. In teaching stations, most of the time, if at 6 minutes bell, they are instructed to ask you some questions. They are instructed to ask you something really important. Because so it's really good thing that when the 6 minutes bell will ring, whenever whatever you are talking about, just summarize that and ask, so do you have any questions about it? He or she will ask you some question. Either he or she will ask you some question, or he or she will give you any for example, in urine statistic testing or an ECG, they will give you some findings and they will say, doctor, what does that mean, can you explain that to me? Or they will talk about the doctor, for example, in abdominal examination, they will say, the doctor, the patient, if the patient has pain in his on his right side, what does that mean? A doctor, if the patient's abdomen is swollen, what does that mean? See, it means that he is given some instruction that you have to ask this question, and they are going to they want a certain answer from you. So for that reason, you have to. It is here that Geeky Medics videos and the PDF files that are available. They're really good source of information. They give you a summary of all the possible of the question of the answers of all the possible questions that people usually are tell that they were asked, and those questions are not any one complicated one, just a simple question you might expect some nurse will ask you or a junior person will ask you similar questions, nothing very complicated that you won't be able to talk about or answer. So this is really important. Again, simulator involvement is the key. If your simulator is involved with you, talking to you, making a good eye contact with you, and even if the simulator is nodding his or her head, that is also an involvement. So you have to keep your simulator involved. There are some questions you can ask at ask your simulator. Is that okay? Am I understandable to you? Any questions for me? Or simple pause, even a simple pause, See, this is an ECG. This is how this is how we calculate the heart rate. Now you pause. She or he will say, okay, or he or she will say, or they will nod. This means that they are involved in what you are talking about. So simulator involvement is really important, and keeping things simple and involving your simulator, you can easily pass the station. Okay, the way regarding the teaching stations, people are always confused that how will my management will be, how will be I scored for data gathering, and how can I score good marks in management. People are not really, most of the people are talked about, people are not really worried about IPS because they give a lot of they have a lot of time to talk about many things, but they are more concerned that how will they score me in data gathering and management. So telling about steps of examination or procedure is a part of your management, but you have to talk about some common abnormalities also. For example, if you are talking about urine dipstick testing and you say that, see, this is the color, this is how the urine dipstick testing strip for nitrate changes its color. Do you know what does that mean to have nitrites in your urine? It might show that you are having some infection called UTI. Okay, now you have talked about a disease. Okay, so you have talked about the step of examination. You have talked about a disease at the same time. For example, you can see this is the color of the urine. It gives you a lot of information. If it is very dark straw colored, that means that it is a concentrated urine. It could be possible when the person is dehydrated. Now there are a lot of reasons of dehydration. Maybe patient is having some the patient needs to take increase his water intake, for example. Or you can say that, this is the characteristic smell of the urine, but if the urine is fruity smell, has fruity smell, that shows that the patient might have diabetes. So you are talking about the information, the procedure, the step of procedure, the finding, and you are telling him about the management. So don't wait for the last 2 minutes that I will talk about the management in the last 2 minutes. Just keep on talking about the diseases or the important points while explaining the station. And if your speed is good, if your talking speed is good, you will be able to cover a lot of things, believe me. So this is something that I have talked about regarding the these are the things that I have decided to talk about regarding the teaching stations. And I will go to where I would like to show you slide again. Okay, the common teaching stations of lab 2, these are ECG teaching station, urine dipstick testing station, EpiPen teaching, abdominal examination, urogenital examination, per speculum, and subcutaneous injection. In these teaching
Hello,
stations,
Saima. Sorry for interrupting. The meeting is going to finish in 1 minute, so we have to start a new one, okay?
okay, thank you.
Okay, everybody join the links again.